certificates will be sent out in the next couple days here, as well as a PDF of slides. And oh, nice. Greetings from Aurora, outpatient in Tempe. Hi, Mark. Oh, gloomy San Antonio. We're actually gloomy today in Phoenix, too. It's crazy. If you are surprised, Baton Rouge, Tempe, Scottsdale. That's so cool. I love all the states. I should get everyone's contact information. That way, when I decide to like do bucket list trips, I can call you. Hey, where should I stay? Where should I eat? Virginia, Mississippi. Awesome. Okay. Well, we have hit the 12:02 point, so I will go ahead and get started. Good afternoon. My name is Debbie Elder from Aurora Behavioral Hospitals. I love that you are here joining us today. We would not, without you, we wouldn't do these. So thank you for always joining us and participating. We have 2 hospitals here in Arizona, one in Glendale, one in Tempe. We serve adolescents and adults, so 12 and up. We have inpatient beds. We have outpatient partial hospitalization, intensive outpatient programs. We have ECT. We do all sorts of amazing and awesome things. We bring horses every week for equine therapy. We bring a dog for pet therapy. We have art and music and all kinds of fun things. I love our adjunctive therapy department and what we do. We take all of the, most of the commercial and access plans, so insurance is not an issue. We're actually going to be having our second annual A Day in the Life of Aurora here in a couple weeks. If you would like information about that, I will put the flyers in the chat. It's really cool. You can stop in. There's about a 3-hour window where you can stop in and see what it's like to experience Aurora just like one of our patients would. You will get to enjoy an awesome, healthy meal. You will get to experience equine therapy. We'll have some other awesome, amazing things for you to do. So again, I will stick that in the chat. I will introduce Katie, who is our business development director, if you'd like to say a few words.
You captured it well. Katie Rasmussen with Tempe and Glendale, Aurora. Thanks, Debbie.
Awesome. Christine, do you want to say anything before I introduce Kevin? Or you may go ahead and go right to the introduction. All right, I'm going to go right to the introduction. I'm going to shrink that. Wonderful. So we appreciate Kevin Lanoue, or Lanoue. Am I pronouncing it correctly? I probably should have asked.
Lanoue.
Lanoue, yay. Kevin is an organic intelligence practitioner based in Tucson, Arizona. For the past decade, Kevin has coached clients in private practice and worked with residents in and developed programming for both Cottonwood Tucson and Sierra Tucson. Kevin integrates training from a variety of additional modalities, including interpersonal neurobiology, relational trauma therapy, Shambhala, and insight meditation, nature-based practices, and experiential learning. Oh, sorry, I lost my spot. Let me go back to that. Shambhala and insight meditation, nature-based practices, and experiential learning to offer integrative support for mind, body, and spirit. Kevin's experiential learning groups include topics such as nervous system regulation, post-trauma growth, forgiveness, mindfulness practices for recovery, tending and organizing experience, boundaries and practice, how we change, recovery skills, and others. Welcome, Kevin. I'm going to go ahead and mute now and turn it over to you.
Thank you, Debbie. Hi, everyone. I'm going to do just a little volume check and make sure that y'all can hear me okay and see me okay. I had a last-minute venue change here, and I'm noticing this room is a little bit echoey. Hopefully, that's not coming through too much to y'all. So. Good. Thanks for coming. Good. I can see some chats popping up. So beautiful. Thank you. Thanks. Lovely. So welcome everyone. Yeah, my name is Kevin Lanoue. I'm here at Cottonwood today at the moment. So I'm coming to you from our campus here, where it is. We just had a little drizzle, sun's back out. Any of you in Arizona know we're praying for rain at this point. So may there be some more. Um, let's see. I'm going to share the presentation, which will be available for y'all by PDF when Debbie sends out the CEUs. So I'll get a PDF version if you're interested in that. And I'm going to attempt screen sharing now. I'm at a workstation with multiple screens that I'm not accustomed to, so bear with me if it gets a little wonky here, but I'm going to try and screen share. And then just to let you know, I've put some pauses into the presentation. So every few slides, there'll be an image of nature, some picture that I took from my phone, which will give us sort of a natural resting moment. So if there are questions at that time, that'd be a good time. Otherwise, we can just pause and we'll move on. So here we go with screen sharing. Do, do, do. Okay. Hoping that everyone can see that. I recognize it's not the straight up slideshow view. Apologies for that. Um, I'm trying to preserve being able to see my notes. I have notes at the bottom of some of the slides. So welcome. The topic today I've taken from an article that was recently published in a peer-reviewed journal from a fellow named Steve Hoskinson, who is the founder of Organic Intelligence. That's a modality that I've been studying in and teaching in for most of the past decade. I did a 3-year training in that myself and then helped mentor people and continued sort of taking classes and workshops and working with Steve. It's a spinoff from somatic experiencing, as one way we could say that. So those of you that are familiar with SE, maybe there's some SEPs here today. We share lineage and language and practices. So um, this article is titled A Non-Directive Positive Reinforcement Framework for Trauma and Addiction Treatment. And today I'm going to try and lean in a little bit to the positive reinforcement framework, focusing a little bit on sort of allostasis and the practice of orientation, recognizing that for some of you, some of this it will likely be stuff you're very familiar with. So feel free to let me know if there's something that you'd like to hear more about. And I might kind of keep it sort of higher level for given the audience here of all of you today. And also, this is my first time doing this version of this presentation. So I just want to say I welcome feedback by email. I'll show my email and text number and stuff at the end. So we need feedback in order to course correct and adjust and change. And I'm very welcome to your feedback. So thanks for being here. I'm grateful to be here, and I'll move on in here. Maybe. There we go. Okay. Right quick. I recognize this is a lunch and learn. So I just want to put a little emphasis on the lunch part right now. Please enjoy your food. I hope that you're getting some nourishment. I have an impulse to ask for recipes if you have something delicious today. But I will say, please enjoy your food. If it feels good to turn video off or not be looking at the screen sometimes, please enjoy your lunch and maybe there'll be some learning too. So guten appetit, aproveche, enjoy your meal. The next thing here is I do want to invite you all to follow your impulse towards ease and comfort. So if that means moving away from the screen or not looking at the screen or standing up and stretching, uh, um, we get accultured to override a lot of these subtle and not so subtle messages from our physiology about what might feel a little better or good in the moment. And so I invite you to do that. Share a quick anecdote here. When I started studying organic intelligence, I did this 3-year training where we met for in person on these 6-day retreats. And then in between, we did videos and worked in person with mentors and etc. And at the first retreat that I went to, Steve was teaching. It was a small cohort of us here in Tucson, actually. And one of the first things he said was, "Welcome, everybody. Thanks for being here. First things first, I want to point out back there in the corner of the room is the spa." And so we all kind of turned and looked, and there were futon mats and yoga mats and pillows and blankets laying in the corner. And he said to us, while we're here together, if you notice that it would feel good to go get horizontal or lay down back in the corner of the room, please feel free. You're not going to miss anything. We'll talk about this stuff more than once. And actually, even if you're back there kind of in that drifty theta state between waking and sleeping, you'll be absorbing some stuff. And even if you fall asleep, you're in a relational field with all of us here, co-regulating, and that might be nice too. So no pressure. And I'll tell you, I almost started crying. Uh, had anyone ever told me to just take a little nap if I needed to in elementary school or high school or college or graduate school or law school, hell, I might have gone to class a little more often. Nobody was saying, I went to Catholic school as a kid. No, Sister Ann Joachim wasn't saying, "Kevin, if you're a little tired, just put your head down on the desk for a minute, take a little nappy poo." That's not how it was. So I share this just to say permission to be human and be comfortable, please. Oh, there I have I have working on a new website. There's some info up on there and an email address for you. My background, I alluded to a little bit. I'll just fill you in a little bit more where I'm coming from here. I have been to treatment twice myself. The last time was a little over 11 years ago. The first time I was in my late 20s, I went to treatment and I went to a residential treatment center for the homeless here in Tucson. And I went for a 90-day program and I stayed living there for 2 years. Um, so the virtues and blessings of residential treatment are certainly part of my DNA. And I love the privilege to work with folks who are potentially changing their lives. So I'm mostly in private practice now, but I do come here to Cottonwood every week to do some individual sessions and then to do some groups here as well. Yeah, formal education, I mentioned, took out a lot of loans and paid the University of Arizona for a bunch of degrees. And it was a decade ago that I really kind of changed everything and got into this work. Great. So for those of you that are still with me here, I'm going to invite you to just share one thing that's going okay for you right now. If you want to just drop something into the chat, yeah, one thing that's going okay. See if I get to see some of these with the screen sharing on. Just going to take a moment for those of you that have access to your keyboard and feel like sharing. See if I can get over and see these. Need to stop my share. I'm just going to do this for a moment. I love hearing what. Yeah, sunny and beautiful today. Excited about a new job, sleeping well. Children are healthy. Feeling better after being sick for a couple days. Me too. I had a cold. You'll see me eating some cough drops today. Sleep has been sleep, sleep, sleep. Alive and breathing. Yeah, beautiful. Cat got a clean bill of health. Yay. Commitment to work. Son is doing beautiful. Thank you for sharing these. This feels so lovely, though I'm not seeing all your faces at the moment. Seeing you sharing these things that are going okay, going good. Boy, that just brings me right into a sense of connection with you all and gratitude for being here. So thank you so much. Yeah, lovely. Mm. Eagles going to the Super Bowl. Oh yeah, sobriety for 2 years. Beautiful. Thank you all. I'm going to come back to my presentation share here. And a little later, we'll tap into a thing around this prompt of noticing things that are going okay. Great. Next slide here has the learning objectives. Um, I'm not going to read them out loud at the moment. I'll just kind of hit on a few. And I have a summary of those in my notes below. We'll leave a little time at the end and maybe we'll loop back and we can just walk through these. We're going to talk about allostasis, which is, we can talk about it as sort of how the biology manages the energy budget and why we want to keep allostatic load in mind for treatment, and an intervention called orientation that we'll talk about in more detail here. So good. I can loop back and fill those out. So here's something I'm sure you're all familiar with. This is that sort of polyvagal representation of the autonomic nervous system responses and sometimes states. This graph is from a woman named Merite Holm Brantberg, who I studied with online, a modality called relational trauma therapy, very much about working with the hypoarousal state, so dorsal, and in particular, how it's stored in the body, and then working with that, and then some emotional qualities of that. So I want to give attribution to this representation. I like it quite a bit, even better than the Deb Dana hierarchy ladder thing. So that's where this comes from. And y'all know Porges's polyvagal theory and Deb Dana's thankfully kind of parse that into language that's useful for the rest of us. And some from Dan Siegel and his interpersonal neurobiology, and I've also studied with him. So we'll weave kind of all of this through here today. So just to hit here, really, I'm not going to drill down too far in these states, ventral and sympathetic and dorsal. Just to note that ventral, characterized by a sense of relative safety and social engagement available there. That'll be relevant to what we'll talk about a little bit today. And then sympathetic as like, yeah, action oriented, the adrenaline, the cortisol, the energy to do stuff, self-protective motor patterns coming online, and dorsal, that overwhelm state, and yeah, how all of the sort of dissociative stuff can show up and be a function of that dorsal when it becomes a state. So what do I want to say about this? One thing that we'll weave in today is this bit about from ventral vagal. I once listened to an interview with Stephen Porges talking to Rick Hansen, who y'all might know from Buddha's Brain and Hardwiring Happiness. And he had this line where he said, the muscles of facial expressions are a functional innervator of the vagus nerve. So for some of us, we like this neuroscience and rooted in the physiology understanding of these acts of simply being human and talking to people and having a give and take. And so, yeah, I just like to share that line from him. And the main reason I wanted to touch on this for today's presentation is the bit about the increasing levels of threat perception, which is along the horizontal axis there. And this is what Porges talks about as neuroception, which is the sort of scanning of the environment for cues of safety and how that's running pre-conscious awareness in us pretty much all the time. And so this is going to be a piece of this allostatic load and orientation practice. So the idea that we have this kind of call and response mechanism going as humans, pre-conscious awareness, sussing out the environment. And if we get the answer that things are cool, we can stay anchored in ventral vagal. If we don't know if it's we need more information, even that uncertainty is enough to start our physiology moving into a sympathetic response. And if the answer comes back that it's a threat, of course, it's sympathetic activation. And if it's a dire threat, our body moves automatically into dorsal. And I find in treatment centers, this is something that folks unfamiliar with it really resonate with, in that it names the part that is automatic happening in our physiology and mostly probably are apt responses to things that are happening. And so this is a good way I've found for talking about like how it's not that people are broken or need to be fixed. It's that our bodies are responding to things in apt ways. The rub is we get jacked into these states, sympathetic and dorsal, all the time. And when we kind of stay stuck there, and don't deactivate or complete a cycle, return to ventral. Prolonged sympathetic activation, it's hyperarousal, that's anxiety. Prolonged dorsal is hypoarousal, and that's depression. So we can talk about these biobehavioral and mental health things in this way that connects to our experience of the world and our bodies. And really, it kind of removes some component of I'm doing something wrong, or why do I feel this way, or what is it about me that makes this happen? Uh, yeah, great. One more slide, then we'll have a little break. So this is the threat perception. So right here was the thing. So what shapes an individual's neuroceptive process, that query around safety, includes past experiences, of course, what's going on in the present moment. And I like to reference like complex system science here and the fact that it's like the present environment also embedded within other larger systems. We can talk about a room at a treatment center and it's part of a larger complex system, which is that facilities kind of system. And then that's embedded in another system, which is maybe Western behavioral health. And that's embedded in another one, which is, yeah, mostly capitalism or et cetera. So these are all things that are coming to bear on shaping our sense of safety. The third one is the state that one's in at the moment. And the fourth one is this intergenerational trauma piece. And then the three directions that neuroceptive inquiry, around safety looks. So it looks internal. So in this way, we're self-referential. We're like responding to the state that we're already in. And I'm going to talk more about this and how the internal attention often raises intensity, and that intensity threshold for a given person can be distressing. It can be to the place where it takes the prefrontal cortex offline and openness isn't available. And so we're going to talk about internal and external directions here. So the second one is external. We'll talk about orientation. And then, of course, the third one is neuroceptive inquiry looks between nervous systems. So that's the co-regulation piece and how it feels to be around others. And it is the necessary piece, co-regulation, to sort of learning self-regulation, and we need it all our lives. Okay, so that's the little intro kind of high-level view on autonomic nervous system responses and states through the lens of polyvagal theory here. And is there anything else I wanted to say about that? Yeah, maybe we'll pause there for a minute. I'll move to one of my pretty pictures here. Yay. That was in Minnesota on an echinacea flower. And I'm going to pause for a moment and see if there's anything that someone wants to double back on or suss out a little bit further before we move on. I recognize it's probably familiar territory for all of you here. Look at the chat now.
I was going to say, I don't see anything in the chat
Oh, great.
so far, or someone asked about when you send me the PDF of the slides, if you could just include the references.
Great. Yeah, I have
That
some
makes
reference
sense. Okay.
slides at the end, and maybe I didn't annotate all of these, so I'll compile a little list here.
Awesome. And is that
Yep,
echinacea flower the one that's supposed to be good for immunity?
totally.
Oh, that's cool. That's very pretty.
Yeah.
Awesome. Well, I will be quiet now.
Thanks, Debbie. I'll move on then, and we'll come to the next section. Okay. Given that my primary lens is through organic intelligence, I just wanted to give a little description of kind of what that modality is. Um, and maybe this middle paragraph would be a decent way to view it here. Rather than focusing on pathology and trauma, OI helps clients connect to and build an innate resilience and inner resource. OI supports healing and transformation from the nervous system up by interrupting harmful patterns related to stress, survival physiology, and redirects attention and energy towards ease and vitality. And we work through image, sensation, somatic tracking, movement, motor movement patterns, mindfulness. And then this piece of like the free association conversation. And I'm going to talk more about that later, which is funny because it sounds just like, you're talking. And there are some dynamics of the free association conversation and finding ease with folks that I'd like to discuss a little bit here today. And then, yeah, we support people's attention going sometimes outward, sometimes inward, staying within, Dan Siegel's window of tolerance lens is helpful here. And he just published a new version of that, a laminated window of tolerance thing from Dan Siegel that is really cool and has a lot of info on it. And so, yeah, one of the things we do in tracking these various aspects of experience is we notice levels of differentiation. So in a sensation channel, that might be something like a person says, I'm in pain, or emotionally, it's like, I feel blah. And then highly differentiated would be something like, oh, I have a pain kind of right in the middle of my back on the left side of the spine, or emotionally, using our feeling words and dialing in what that emotion of blah might be about. And as we differentiate experience in these various we call them like channels of experience, then we look at how they can come together and sort of represent a felt sense of coherence for a person. Yeah, there's an organic intelligence website. If you're interested in learning more about that, you can check that out. I just did want to share one of my favorite things that we often talk about in organic intelligence is we talk about definitions of trauma, and I do groups here in treatment centers where we talk about trauma and we use various definitions, and I'm sure y'all have ones that you favor. And here's one of my favorites, that trauma is unintegrated resource. So we talk about trauma as sort of a time travel, usually to a like worse place in our physiology. And that when it's unintegrated, it's still active like that. But after we've integrated traumatic experiences, it's a resource. And this can show up. So the field of post-traumatic growth has stuff around this, right? With like increased appreciation for life, better relationships. They get the 5 things that that field of post-traumatic growth looks at. Here, I think also about right compassion for others, ability to see others who are suffering in ways that we're familiar with, and modeling behavior and ways forward for others. So yeah, like to talk about trauma as unintegrated resource, and this integration piece was a couple lenses for this. The first is through the organic intelligence lens. Here is we track things particularly in image, body sensation, orientation, which I'll talk more about, in meaning and cognition, and then in affect or feelings or emotions. And so we consider how to support people integrating across those channels. And in Dan Siegel's interpersonal neurobiology has like 9 of them. And this expanded sense includes some things that are really specific to the neurobiology, right? Like vertical is the hippocampus linking implicit and explicit memory, how that gets taken offline during trauma and how we can bring it back online through narrative and story to integrate traumatic experiences. The bilateral one is the corpus callosum connecting left and right hemispheres of the brain in terms of the uh, aspects of the experiences that we've had. So without drilling down on these a whole lot, I just wanted to note this sense of working with integration across these various aspects of experience in the body, and some that are, yeah, maybe, I mean, they're all rooted in the body, but some that are maybe a little more even metaphysical or ethereal or of consciousness, and this mechanism of differentiation and linkage. Yeah. One more slide and we'll have another little pause here. So this is a map that we use in organic intelligence, where I just talked about these different channels of experience and the radiating from the biology. And meaning and affect and image and sensation are generally internal orientations. That is to say, we're tracking these, we kind of look inward. And orientation is an external move. And so we'll talk about how that relates to allostasis and working clinically here in a minute. Yeah, it's like maybe these channels could all be equally available to a person, and generally one or two are running kind of hot, right? Those days where we're all in our heads and ruminations and busy brain, or perhaps an affect where it's a lot of feelings and not a whole lot else. So we look for what's happening across these channels, sometimes like an explicit, maybe changing channel kind of move. But more frequently, we're just looking for where in any of these channels something that's organizing and helpful is coming through. We find that through the free association conversation. And then when these things show up, we bias our preference of attention towards this stuff. So we're keen to talk more, notice more, feel more of those organizing things coming through. And this is at the crux of the OI way of working, really, which is that it's less about a person externally sort of telling someone what to do and more about finding what is emerging for them in terms of, yeah, what feels good, sense of purpose, yeah, what their version of a thriving, enjoyable life is. Good. So that's a little bit about organic intelligence and how we work in that modality. And I'll do another brief pause here, see if anybody has anything they want to check out before we move on. Debbie, instead of switching to the losing the screen share, I'm just going to keep this picture up, and you can let me know if anybody has typed anything in that they want to talk about further.
Perfect. I have not seen any questions. Oh wait, is that slide Fleabane?
I think so. Yeah, I think so.
Oh, I'm like, I don't know what a fleabane is. Okay. Is that the flower?
Yeah.
Oh, very cool. Well, yes, it
I'll
is.
just also do a brief check-in here in terms of pacing and yeah, level of information and how this is going. No questions. That's great. I hope everybody's enjoying lunch and feeling restful. Um, and if anyone has any feedback on how that's going at the moment, if there's any adjustment I can make that serves this better, I'm glad to.
Let's see. This is all very cerebral, deep, and challenging my brain in a good way. I like that.
Yeah, a lot of words, interesting stuff. And I get it. It's Yeah, it's a lot of talking.
It's awesome though. Cool. Well, that's all I see so far.
Great. I had in mind for us to do a little breakout room experience that would be a break from this dynamic, but it looks like we're not gonna be able to do that today.
No,
Um,
sorry, our license doesn't cover that. I looked around everywhere because I knew I had checked into it before, but it still doesn't. So sorry.
right. So what I might do is yeah, this is a decent enough time for it. Why don't we just take a moment here and I'll invite everyone to just I'll watch the clock, I'll give it a minute or something um, to just have a look around wherever you are. So we're taking our eyes off the screen, um, letting the eyes go where they want to go, just kind of spontaneously moving about, maybe even taking in what's behind you or what's out the window, and just bringing attention external into the present moment environment here. And in fact, if your eyes eventually settle on something that's okay to look at, I'll invite you to linger with that a little longer. Doing visual orientation here, the invitation is to like notice the thingness of the thing that you're looking at. So that would include colors and shapes and textures and patterns and stuff like that. So just take a moment to have a look around, and if your eyes settle on something that's okay or even pleasant to look at, kind of taking in some more of that. If anyone notices any shift in how your system is tracking overall here between before and doing this little bit of visual orientation, and you want to share something in the chat, that would be awesome. No pressure, but
I love this. This time is such a gift in a packed day.
yeah,
Took a sigh.
terrific. Any other comments there, Debbie?
Let's see. Calming and yet a boost in energy, clarity, and mentality. I'm looking out of my picture window at my cactus garden. It is so tranquil. Taking in the rare clouds outside. And we don't have clouds very often here. Present. Reminder to take in moments during the day. These are awesome.
Wonderful. Thank you. And thank you
Let's
all who shared.
Oh, first notice my cat is a distraction, then notice outside beautiful sun, then a shadow. The shadow was so intriguing with the sun contrast. Love it.
Wonderful,
Artistic. I
right?
like that. All right. Thank you. Oh, watching my puppy curled up in the window seat. Oh, I love animals.
Yeah.
All right. I will close or turn my thing off again.
Okay, thank you, Debbie. And thank you all for sharing your experience. I'll talk more about this, that this is an important part of the clinical protocol for working with folks here is this orientation practice. I mean, I've come to think of it as like more than half of the game for sure. The invitation to notice things internal, right? Like memories or emotions or thoughts or stories or past trauma and stuff. I don't think we need any more invitations for that. Somehow we're doing that a lot of the time. And this simple practice of connecting to the environment, our biology is built for it. It's what our brain and our system wants to be doing. And often this brief practice of orientation, connecting to the environment through the senses, externally, this one we did visually, will bring for folks some of what you all reflected here, like that more spontaneous in-breath and the sigh, or some sense of calm, or some muscles relaxing, um, noticing something pleasant and enjoying that. It can be, and pretty consistently seems to be, a mechanism of downshift, right? Return to ventral vagal from a state of excitation. And I mean, that shit is free. You can do sorry, sorry, came out. It's not my intention to offend by cussing. I generally do that, and I'm doing pretty darn good so far. Um,
There's
reminds
a
me,
there's a please continue to swear LOL.
great. I I get a lot of those. People do tend to enjoy it. I'm doing my best here. Um, it reminds me, y'all probably know Brene Brown, the researcher and kind of celebrity person around shame and stuff. And I don't know if it was in a book of hers or in an interview where she said, she works with big organizations. She gets a lot of inquiries to come work with folks. And she said she gets letters where they usually run along one of two lines. People say, Brene, we love your stuff. We'd really like you to come work with us. Just one thing. Could you dial down the cussing? And the second one is, Brene, we love your stuff. We'd really love you to come work with us. Could you just tone down the God talk? And then she says something like, and I respond the same to both of them, which is maybe she said, hell no. But right, because that's part of just like who she is and what is an embodied experience for her. And that's true of me too with the cussing. So yeah, outside of this format, if we were talking or doing a group, there'd probably be a whole lot more of that, but I'm doing my best here today. I find it in my system to be a thing that just uh, feels easeful, and in that way is helpful. So anyway, orientation, that shit is free and is worth feeling into for our residents, for all of us, just as much as we can. So letting the eyes go where they want to go, settling on something. I'll narrate out loud right quick. My eyes have settled on this bag that's on the floor in here, which is purple and has the word party written across the top, and a giraffe whose head takes up about the middle third of the bag, and the yellow giraffe head, and 6 or 7 brown spots on it, and two big eyes with little blue dots in the middle. And there's a border along the top of alternating colors. I can see the inside of the bag, which is white. I can see a shadow being cast on the wall to the right of it, etc. Right? So that is connecting to the environment through the senses externally with specificity. Notice what I didn't do. I didn't go, oh, I'm looking at this bag on the floor and that must be a Trader Joe's bag, but I don't know. I never got a party bag at Trader Joe's. I always get the ones that just say Trader. That's something else, right? Or say, oh, I see that bag on the floor, and that reminds me of the bag that was at my grandma's house that time that my dad came home drunk and he stepped right on the bag, and inside was a bunch of eggs. And that's my system dealing with allostatic load from the past around stressful stuff and turning to one of those other channels like memory or thinking or emotional experiences. And orientation is this very specific connecting to the environment through the senses externally. And I'm going to talk a little bit more about why that's important and how we use it. Good. Maybe there's a few more chats dropped in. Debbie, is there anything I should know about before I move on here?
Let's see. We have one question. Well, we have, do you want the comments or the questions first?
Let's take the questions.
So, first question is, can a person develop self-regulation when in an ongoing domestic violence relationship, or can a soldier regulate when in the trenches?
Yeah, right. Um, I mean, interested in this conversation. My first impulse is, we want people to be safe. And so both of those contexts, a person isn't safe. And so regulating in an unsafe environment is kind of possible. We think of it as override. Also sort of like habituation, right? That's the being. I was thinking of the military person. It's like training. It's like first responders. They get trained to go enter a building on fire. Thank goodness for their work. And also at a biological level, a person's system says fire, don't go that way, run the other way. So we override functionally sometimes because we have to or we choose to. And when we're talking about regulation, really it's moving in between these ways of like ventral and sympathetic and even dorsal as needed and like recovering from them pretty soon after. It's not that we don't get excited, it's that we don't get stuck there. Now, I forget who it was who wrote about those nervous system states and said, our nervous system evolved to have those responses in short increments as needed, like 30-second burst, and then either it was over or we were over. It's like the scenario of running from a tiger or a bear or something, right? It's like a big burst of energy, maybe even collapse into playing dead, and then it's over or I'm over, but short bursts occasionally. And now we're getting jacked into those states all the time. We're not completing cycles of activation and deactivation. It's unmetabolized and we're carrying that charge. So, could a person be self regulating in a high intensity context? To some degree, right? We know that the higher the level of sympathetic activation, the less available the prefrontal cortex is. Some parts of us are not as online in that context. Mm, yeah. It's not that the world's always safer, that we don't encounter crises. It's that we could respond to them appropriately, aptly, and recover from that. But both of those situations, those scenarios that you described, that's like prolonged chronic exposure to high intensity, let's say traumatic things. And we know that that particular kind of trauma is like 80-90% more likely to lead to addiction and depression, anxiety, and all that stuff. So, yeah.
Interesting. Let's see. Everybody says be yourself as far as your how you talk, and that how we feel is on us, which I think that's really cool. And then practice what we preach about that. And
Right.
then I am totally unfamiliar with OI. Can you please recommend some material or reading regarding organic intelligence for those of us new to this modality? And then someone else said ditto and ditto and ditto. So, and that was
Great.
the only question. So I'll let you answer that.
Okay, cool. The noticing that we're probably at about the halfway point, so great. Real quick, just to address the organic intelligence questions, there's a website, organicintelligence.org, and I think they have an article posted up there. They offer a bunch of trainings and classes and some free workshops and etc. So that's the source for that stuff. Um, and I'll give my website again too at the end here. And I do workshops and staff trainings and courses and stuff like that. I don't have any of it posted on my website yet. I'm getting some help with that, but you can also email me for more information or let me know exactly more what you're interested in particular, and I can send you some info, hopefully. Great. So moving into allostasis and the predicting brain. So um, there's a lot of complex system science that we can talk about here. I'm going to just kind of keep it high level overview kind of stuff. So allostasis is managing the metabolic budget. Basically, the brain is a predicting mechanism, right? Collecting information and experiences, and then the brain encounters a moment and makes a prediction about what's going to happen or how it's going to be, how what's happening. Is it safe or not? Is this appealing or not? Approach avoidance, etc. So the brain does that predictive thing, and it's readying the system for what's next. So there's a metabolic cost potentially associated with what's next. Should I ready for action? Is what's next a thing that's distressing to me because it's familiar from the past or whatever? So for the learning objective thing, allostasis, managing the metabolic budget, it's like preparing us for what's next. And then I talked about this a little bit. Negative intensity draws attention inward, so the attention is withdrawn. And one of the things we know about that is that it decreases executive function. So there's an opening here to talk a little bit about some of the major brain networks, right? Like executive network and default mode network, and then the salience network, which decides which one to be um, recruited or invoked at a given moment, and how those networks, those two are like mutually exclusive. So when we're in default mode network in the brain, executive network gets to rest, which is super helpful. That's probably another uh, topic that I won't go into too far in terms of the brain network stuff. But the main takeaway here, I think, is this: that negative intensity draws attention inward, decreasing executive function. And you can compare this to that experience of orientation and bringing the attention external as an intensity modulating kind of thing here in this context. Yeah, I talked about this before, just how we can have meaning, affect, image, sensation invoked in intensity and turn our attention inwards. And orientation is this counterbalancing practice and way of experiencing the world where we're oriented towards the outside more. And that reduces intensity in those other channels. Okay. Oh, yeah. It's kind of like this bit around allostatic load processing and readying the system for what's next. You might be familiar with this term eustress, which is when I'm in my like window of tolerance preparing for what's next, and I have a positive response to stressful, like energizing stuff. So this is enthusiasm and positive experience and like excitement. And then distress is when I'm outside of that allostatic load processing, outside that window of tolerance. And this is an interesting piece with addiction because this is the dysregulation of the reward system. And that's that long-term planning reward circuit that runs medial prefrontal cortex back to the amygdala. That one is less available or taken offline, and it's the short-term reward circuit that's getting preference, which is basically, I want to feel differently right now. Um, okay, so allostasis, readying the system for what's next, brings us to another opportunity for a little pause. Just do a quick check-in, Debbie. Is there anything brewing in chat?
Nope, all is quiet on the chat front.
Anybody want to do a plant identification here on this one?
Oh, geez. Jungle plant. Or maybe corn. I don't know. Clearly, I don't know my plants.
I think it's mullein. I
What's
think
mullein? Mullein.
that's it. And with the that doctrine of signatures, right? With what the plant looks like, being related to what its medicinal properties are. And I think this is a lung plant. I think mullein.
Oh,
I think
interesting.
so.
Very
Okay.
cool. Yeah, no guessers.
Okay. uh, moving along here. Good. So we'll talk a little bit more about orientation now as the bridge between inside and out. So when we talked about the brain as being a predictive mechanism, accumulating info and then encountering a moment and having a sort of expectation what's going to happen next, the I used to kind of think of that in terms of having a bunch of internal maps. And what's happening is there's a comparison between this moment and the maps that I have. I now think of it as just one map that's constantly being updated, hopefully, actually, hopefully through positively valenced experience. But orientation is a practice that makes a bridge between this internal experience, the old maps, and the present moment, connecting to the environment through the senses. It's attention outward. Oh, yeah, this is where I was going to do the orientation exercise. We already did that. Some bunch of stuff on neurobiology and orientation. There's this self-mapping piece that humans like to kind of have a sense of where we are in space and in the environment. And so that is a down regulator for the autonomic nervous system, having a sense of surroundings. So that's another benefit, that mapping bit. And these are this bottom one from the Long and Zhang article. Bodily representation, also known as embodiment, is functionally related to connecting to the environment through the senses. So some supporting stuff from neuroscience around this practice of orientation. When not withdrawn to internal intensity, like fight and flight, the normal function of orientation as a salience-driven, effortless, and automatically mapped state is a resourcing aspect of the default mode network. That's that major brain network. This is a lot of info. I'm going to skip that one. And yeah, here's the sensory system is a primary contributor to pathways of interconnection and has been implicated in an fMRI study as a deficit in adults with PTSD. So impact of trauma and disruptions and dysregulation to this sensory processing stuff. So back again to the practice of orientation. Here's one from Ruth Lanius, some of you may know. People with no trauma history showed more connections between the insula and the brain areas involved in monitoring the environment and processing emotions. Here's another scholarly article supporting this here. The centrality of this bridging between the external and internal world is cited in a recent study where the sensor and motor associative axis in the human connectome, which basically, right, means like all the brain networks, is described as a core pillar of cortical organization. And so orientation is, we're saying, likely a key aspect of perhaps the primary organizing gradient for the brain. So orientation is the bridge to what the brain wants. The brain wants to map the here and now so that I'm ready in advance. That's that predictive thing. And it's what the biology wants to be doing. So we talk about this in terms of prepared learning. It's what a person is already wanting to do. So it's low allostatic cost. It doesn't take a lot of energy in order to meet that impulse that's already present in us. Good. Pause, see if anything there made sense or was interesting to anyone or questions.
Let's see here. A couple. Can you speak again a brief summary of executive network, default network, and salient network? And then the slide you skipped was amazing. Please post it again. And then there's some other, oh, and then how is orientation different from mindfulness?
How is
Okay.
orientation different from what?
Different from mindfulness or different than
Uh-huh.
mindfulness. So
Great.
those are the three or
Okay, cool. Let
four,
me grab
three.
those two. First to the mindfulness one, and then Debbie, I might ask you to remind me about the one prior to that. First to the
Sure.
mindfulness one. So, I mean, we know that mindfulness, I mean, it's an EBT now, right? It's like insurance companies will pay for it. It's been well studied, the benefits of mindfulness practices and meditation. Um, I'm an advocate. I've been on two week-long silent meditation retreats in the last year. And the thing around eyes closed meditation and tracking internal thoughts or body sensations or whatever is like, might it lead to that sense of less attachment to the moment and therefore support like decreased anxiety, this predictive thing of what's going to happen, might it loosen the grip of that? Might mindfulness practice loosen the grip of that? For sure. Also, uh, mindfulness, internal, especially eyes closed, sort of meditation practice, a couple things that can support and reinforce dissociative states. So for folks that are predominantly like kind of stuck in dorsal or where any of that dissociative spectrum from low level stuff like fainting or spaciness up to DID or catatonia or whatever, all of those kind of states, that supporting or practicing a bunch of eyes closed internal quiet place thing is awfully close to that, close to those dissociative states. And so in that way is very different from orientation, which is present moment external world, right? And another thing around meditation practice, as any of us who do it know, it ain't easy. And we spend some times with a bunch of monkey chatter going on in the brain. And for people new to meditation, I've seen this in treatment center settings. Some people kind of really take to it. A lot of people will say, I can't meditate, my brain's too busy. And then we try and tell them that's why it's called a practice and maybe check it out. But to the extent that it's reinforcing the internal narrative of I can't do it, or I'm not doing it right, or there must be something wrong with me, it's not helpful. And it's the opposite of orientation, which is that external, what's here right now. If it's a safe enough context, orientation is a biohack. Orientation is like a back door into the autonomic nervous system. When we're connected to the environment through the senses externally, what the autonomic nervous system is basically hearing is, oh yeah, I forgot I'm on a screen here, is I'm here, I'm okay. I'm here, I'm okay. Which is quite different from trying to tell ourselves that in cognition, right? If I'm sitting there going, I'm here, I'm okay, I'm here, I'm okay, I might not be here and I might not be okay. The orientation, when we're oriented, connected to the environment through the senses, external attention, the autonomic nervous system is receiving that information. I wanted to say implicitly, but I'm not sure that's quite the right word, but that's what the autonomic nervous system is receiving. It's receiving, I'm mapped or mapping, I am noticing things in the outer world. I'm not tracking internal intensity. I'm connected to the external world. That predictive part that wants to know what's next is always alive, and it's being matched right now with what's here right now. So provided that it's a safe enough environment, that wouldn't be true if we were so the old cartoons where there's a piano falling out of the sky or an anvil. Those are the two things that are always flying out of the sky: pianos and anvils. Um, but if we're in a safe enough place, orientation lets land in our nervous system an experience of present moment okayness, and it's low allostatic cost. Whereas internal meditation can be high cost through the efforting that's associated with it. I think that's my answer on the meditation bit. Debbie, can
Okay.
you remind me what that first one was? I know it was looking at that complicated map and then something else.
I will. And then there's a couple others now too. Let's see. Can you speak again a brief summary of executive network, default
Right,
network, and salient network?
right. Let me do that piece right quick. So, major brain networks are super fascinating. I'm not a neuroscientist. I'm no expert. I'm just fascinated by this stuff. So I try and learn what I can and bring it to bear on the work that I do. Uh, and so these major brain networks. Also, I just got to say, it's kind of hilarious that we're using our brain to think about our brain. There's always a piece to that that makes me wonder if that's why it's so enjoyable to think about. And also, how far can that go? The brain understanding itself. Uh, Executive network, real simply put, you can look these up: executive network and default mode network. Default mode network is super fascinating and is implicated in psychedelic medicine stuff. Uh, and so executive network is kind of like long-term planning, focused attention on complex things, goal-directed behavior and problem solving, kind of how it sounds, executive network. Medial prefrontal cortex. Default mode network is more of the what some people call it mind wandering or daydreamy, like self-referential, reflective kind of state. So yeah, real simply put, maybe those are good ways to think about those two networks. Salience network is what I mean, I think I don't know this, but I feel like this is related to the allostatic processing and even to that neuroception. I think we're kind of talking about the same stuff in different ways because the salience network then is deciding which of those networks needs to be engaged right now, right? Just like neuroception is like, is it safe or not? And allostasis is what's the relationship between this prediction of what's happening now and the map that I have. Salience network decides which of those two other networks should be lit up, engaged. And it's my understanding that those two networks are mutually exclusive. That is, salience network directs energy and information to one or the other of those networks, but they're not engaged at the same time. And where a lot of people can get sort of like executive network all the time, being in default mode network gives executive network a chance to rest so that when you need it again later, it's had some recovery time. Yeah, that's the bit on those. I will just briefly show that map that you asked about. This is from Organic Intelligence. This is one of a number of maps that we use in training and communicating and understanding this stuff. There's a lot here. And so I'm going to move on because I do have one other map at the end that I think is a little easier to just talk about and use today. Uh, but I'll
And
have this
then,
in the
oh,
in the
sorry. We
PDF. Go
had
ahead,
a
Debbie.
couple other questions, but
Yep.
time-wise, whatever you think.
Okay.
We're at
Let's
111 now, so
great. I'll take the questions real quick.
okay. Um, Let's see here. Closed eye mindfulness can be used as avoidant, should not be the only skill being used. Mindfulness can be focused on what's happening now using five senses with no judgment.
Totally.
How is it the same or different than OI?
Yeah, those meditation practices are totally what we're talking about. Um, right. I love those, like eyes open, even walking meditation. And so this is orientation is like, and mindfulness are uh practices that regulate our system, practices that give us ways forward with more ease and gentleness, and they're awesome, and we need to use them all the time. Um, I would say orient that OI encompasses a bunch of other aspects of a clinical protocol related to supporting people, but mindfulness is definitely one of the core pillars.
And then the other one um, is the goal to help the brain reorganize itself after trauma? And how does this compare to the practice of EMDR? And that
Oh
was the
yeah,
only other one.
lovely. Um, I might more or less punt on that because I'm I would like to talk about some of how I understand EMDR to work and the parallels here, but I'm not enough of an expert on it to feel that it would be useful to everybody. So maybe if that's a conversation that that person is interested in having with me, feel free to email me. I'm interested in talking about it, and I think I'll try and move on here so that we can get through this last bit of the presentation, and then I can make sure everybody's got the learning objectives met, if that sounds all right. So orientation in clinical use. Right. This is the part where I kind of talk a little bit about the what we're up against, right, with the negativity bias that's inherent in our neurobiology, right? And the reinforcement of that what's wrong attention that happens kind of constantly, and as a function of culture and context. What is it? The adverse experiences take up three times as much of the neurobiological real estate as pleasant ones. So there's an evolutionary imperative or inheritance there, right? About it. It matters to understand where the risks are or the dangers or the berries to avoid or whatever. And boy, we're getting that stuff reinforced all the time, right? The news, cheapers. The news is not the news is not a you know 30-minute program of things that are going swimmingly in the world, right? Uh, Here's another report from the far corners of the globe of people treating each other well. In fact, it's not a 30-minute program anymore. That betrays how I grew up relating to news as a thing that was on 30 minutes a couple times a day. Now we can get ahead of that shit all the time, and many of us do. And that reinforcement of the what's wrong attention is a big part of what we're up against in supporting people, hell, for ourselves for that matter. Uh, so this bit about negative urgency and addiction to relief. So there's like an addiction to intensity. There's the reinforcement of the negativity bias and the what's wrong attention. And then there is the desire to feel better or differently, frankly, to feel differently. And that's the piece here. If I have an inwardly negative state, I compulsively move toward making it feel better. That can be predictive of addiction and relapse. It's the compulsive action to stamp out what's wrong, I should say. And then there's a negative feedback where it's like how I feel better is by feeling worse first. And so we use orientation and like orientation to things that are neutral. That's part of why at the beginning of this, I asked you all to maybe drop into the chat one thing that's going okay. not asking what's the best thing or what's the greatest thing that happened to you this week or anything. It's like that okay zone, even the neutral zone. Of course, anything of a positive valence, and good is and pleasant and great is all very nice. And often in working with folks in our more acute contexts, um, even neutral, actually, we kind of have to start with neutral. Uh, it has to do that last sentence there. The bigger the gap between bad and good, the more reinforcement of negative urgency. That just has to do with internal map, accustomed to distress, looking for the greatest thing that happened in the past week. That's a big gap between bad, internal maps of bad, and external sense of good. We want to get to that just kind of neutral, what's okay, what's kind of pleasant. Orientation also is a way that we can assess resilience, right? Because the ability to orient uh, tells us something about the state that the system's in. And I'm going to get to a map that'll illuminate that a little bit. Here's this piece about like stress management techniques and other energy intensive actions where we aim to increase executive control. So we're trying to do something, better doing, which includes orienting and top-down CBT, DBT, top-down stuff. Even the instruction, go relax, go do yoga, all of it, it's doing. And however, there's evidence that inhibitory management involves the overuse of executive control. So we're naming this piece of like really finding the gentler, sweeter, within close at range kind of place to start. Like orientation is a requisite initial condition for change, the capacity to have some connection with external world. Yeah, it's a proxy for ventral vagal, right? We can start feeling like I can see the world around me and things that are okay, and that can open up into actual social engagement. Both of those things feed ventral vagal state in the nervous system. Talked about this. It's kind of like we're built to do this, that predictive bit. So it's prepared learning for our system, and therefore it doesn't cost a lot in terms of allostasis. And here's this range of readiness. So this map shows a little bit about how orientation can illuminate, as well as being a practice, it can tell us something about a person's system when we're working with them. And I'm just going to do a real quick description of this map where phase 1, phase 2, and phase 3 appear across the top. We kind of view people's biological system as phase 1, phase 2, or phase 3. And of course, there are a bunch of little iterations within this. They're not just one lump bucket kind of thing. There's early, middle, late, or whatever. And mostly, I think folks come to treatment and it's phase 1. I know that sure as hell is how I did when I went. And that can show up and be observed as both kind of out of control stuff and also overly controlling. So it doesn't look one way, but there's limited capacity for processing and new things there. So we work in a particular way with phase 1 folks. Phase 2 is where this orientation practice can show up. And then we talk about orienting to sort of pleasurable things, wholesome pleasures that are non-addictive, non-substance related, not too intense, as the way of moving through to phase 3, ideally, right? And I did make a little note. Yeah, it's okay. Let's leave it at that. So phase 1, phase 2, phase 3. Negative reinforcement moving towards a positive reinforcement framework. Do, do, do. Okay, summary on orientation, right? It's low cost. It's the bridge between internal and external. It also shows us something about resilience in a person's system. It's a natural mindfulness practice, and it modulates intensity in terms of like downshifting towards ventral. Do, do, do. That was a little bit about working with folks. If we did the breakout room, I was going to offer a little practice we could do together. Okay, maybe we'll take one more round of feedback or questions here. I have a couple more slides I can go through, and also we're fine if we don't. Should we
So
revisit
far, so far none.
great. Let's just see what we have remaining here. Yeah, this difference between like doing orientation as a thing that we do versus after a while, it's just kind of part of how we're moving in the world. Um, do, do, do. Yeah, it's just the difference between the doing versus uh yeah, this kind of taps into the complex system stuff, how complex biological systems are self-reinforcing, so they spend energy to maintain homeostasis. And so once that state of homeostasis shifts from a sort of homeostasis of chaos to a homeostasis of agency to a homeostasis of more overall sort of calm and enjoyment and being, uh, that's the shift from sort of doing self-regulation work to kind of auto-regulation being present in the system in a person's body. This is a breakdown on some of these aspects of phase one and phase two and phase three. I think we'll go past those. This is right hemisphere, left hemisphere stuff. Yeah, a little summary here on orientation as the bridge that links outer to inner experience and aligns with the brain's primary job of prediction. I'm going to pause here to ask, shall I run back to the learning objectives slide and we just do a quick pass through those and see if there are any questions? If anybody wants to, yeah.
Yeah. If you want to do that, and then Christine's going to say a couple words
Beauty.
when you're done. So perfect.
Great. Here is the learning objectives. Great. Um, I'm just going to run through these right quick. So allostasis, managing the metabolic budget, importance of keeping allostatic load in mind for treatment. What's a good way to say it? Huh? Would I make a note on this maybe? I did. Okay. Yeah. For important in terms of a person's receptivity and paying attention to the sort of predictive part of it. Because when intensity is high, prefrontal cortex is less available. This kind of comes down to that thing of like, even at the cellular level, right? Every cell has a membrane, and a cell membrane has an intelligence to it. When the cell encounters a threat or a toxin or something bad, the membrane becomes more hardened and doesn't let things pass through. And if a cell encounters another cell that it's cool with or a safe environment, the membrane becomes more porous. That's how cells link up and split and divide and things grow. And so a cell can't simultaneously be in protection mode and growth mode. So that might be a way of thinking about this too. Keeping allostatic load in mind for treatment, protection mode versus growth mode. Describe one intervention for helping the brain. That would be orientation. One clinical benefit of orientation, we could talk about that as a nervous system down regulation towards ventral. And why the difference between doing orientation and being oriented is important, because doing still costs energy. So while we have to start there, we have to start somewhere. So we do have a practice of doing that we can observe when it goes from less doing to more being. And that represents a phase shift or anyway, a level of growth, a new threshold of growth and well-being. Okay, recognizing we're getting right at time, I'm just going to throw my info up real quick and then Christine can jump in here. So there's my website, which is kind of taking more shape, but you can sure reference that. I'll be posting some new stuff coming up there soon. My email address. And I put my cell phone number up here. If any of you manage to sit through this whole thing and have any feedback you want to give or want to be in touch that way, I welcome your text messages. Just to have a little sense of how it went for you today. So thanks again, everyone. Thank you for having me.
Awesome. Thank you. And just reminder to everyone that when the PDF of the slides goes out, you'll have all this, excuse me, information as well. So I am going to put up just a QR code if you would like to leave a review. I welcome you to, not necessary at all. And I am going to turn it over to Christine to say a few words about Cottonwood Tucson.
Thank you so much. Thank you to all who attended and Kevin for presenting and letting us all be inspired by OI. And we're grateful that you are able to offer that to our patients at Cottonwood Tucson. And thank you to Debbie and Katie and Aurora for hosting this amazing Lunch and Learn. My name is Christine Driscoll, and I am the clinical outreach representative with Cottonwood Tucson. And I would love to connect with any of you if you'd like to learn more about Cottonwood Tucson. Our website is cottonwoodtucson.com. It's an amazing program. We've been around for 38 years. We treat 18 plus, so all adults, all genders. And we treat mental health primary, SUD primary, and co-occurring. But what really sets us apart from many programs, almost all, is that we customize a treatment plan for every single patient. So we offer over 30 modalities, and to include OI. We have a 35-acre property where we have all levels of care. So detox, inpatient, but only for our patients. So if someone comes to us and is in detox or RTC and is struggling, it's less traumatic for the patients, and a continuity of care. So they're able to stay with the same team and step right back down to level of care that's appropriate once they're stable. So we also offer detox, inpatient, RTC, PHP, IOP, and virtual IOP. And we are in network with many insurances, but also any PPO we can work with. So we're in network with Aetna, Humana, Beacon, and TRICARE, TriWest, VA Community Care, and a few others. So I won't go into that, but I really appreciate your time and your interest in Cottonwood Tucson. And Kevin and Debbie, thank you so much. Hope you all have a lovely day.
Thank you, Christine. Yeah, Cottonwood Tucson is beautiful. I got to take a tour there a couple of years ago when I was in Tucson for a conference. Obviously, I already love animals. They have horses down there. So any place that has horses for equine therapy is okay with me. But it really is, it's an amazing program. It's a beautiful setting, and they are, truly dedicated to the health of their clients. It's amazing.
Thank you,
So
Debbie.
yeah, I love it down there. We have hit 1:30. So I appreciate everyone being here. I look forward to hopefully seeing you all again next month for next month's webinar, which I believe is one of our Aurora doctors who's going to present. If you have any questions, you need any information, please reach out by email. We're always happy to show you around. And again, thank you so much. I hope you all have an amazing rest of your week, and I wish you all the best.
Thank you so much. Have a
Thank
great day.
you. Thank
Bye-bye.
you so much, Kevin, by the way. That was amazing, and like 1,000 thank yous and great presentations in the chat. I don't know if you were looking at the chat.
Thank
There are
you
so
all.
many thank yous. So this was awesome. I appreciate it. And thank you so much for taking the time to talk to everyone today.
Thanks. Hope to see y'all some other time.
Great. Bye.